Gestational diabetes is a type of diabetes that develops during pregnancy. The reason for this is because changes in pregnancy hormones cause the body to become less sensitive to insulin, which can cause elevated glucose levels. Usually it develops in the second half of pregnancy, and there is a peak of this insulin resistance around week 24 to 28, which is why we recommend doing the screening in that time frame. The screening involves drinking standardized solution of glucose. You take a packet of 75 grams of glucose and dilute it in water, and you have to drink it in a few minutes. They do a 0-minute blood draw, and then you drink the solution in a few minutes, and then after that there's a blood draw at 1 hour and a blood draw at 2 hours, and they basically monitor the levels of glucose and the levels of insulin in certain cases. If your 2-hour blood draw result is 7.8 or above, then you are considered a gestational diabetic. If you have gestational diabetes, you need to make an appointment with a diabetologist, who is a doctor who helps you to keep your blood sugar levels in check. Usually moderate exercise and dietary changes are enough to keep blood sugar in check, but in some cases you may need to use insulin supplements to keep your blood sugar levels at an appropriate level. In cases of pregnancies with gestational diabetes, your doctor may decide to monitor the pregnancy more closely, which may entail more frequent checkups, or in some cases doing regular ultrasounds with measurements to see the fetal development or the fetal weight estimate. Gestational diabetes does not necessarily contraindicate having a vaginal birth. After delivery, in most cases, gestational diabetes resolves itself, but because patients who had gestational diabetes are at a higher risk for developing diabetes later on, it is recommended to do blood sugar screening once again at 6 weeks postpartum when you come to your checkup in the delivery room when the baby is born. In some cases, if there have been big fluctuations in maternal blood sugar levels, then they may need to do blood sugar monitoring for the baby. Early screening for diabetes is generally recommended in patients who have insulin resistance, have had a prior pregnancy with gestational diabetes, and it is also recommended in patients who have an advanced maternal age, so for patients above 35 years. The early screening is done between week 16 and 18.